The other day I was in the Apple store looking for the latest version of the iPad. My interest was in its voice recognition technology to pair up with my teleprompter voice-activated software. Now, my salesperson really knew his stuff, so much so I felt overwhelmed by all the information he gave me about what I needed. At least he thought I needed it. I didn't. What I wanted was for him to understand me and sell what would work, not to educate me on all he knew about voice recognition. Now, after a few minutes of his lecture, I had to stop him. He was answering questions I didn't ask. Now, yes, I bought a new iPad in spite of everything he knew. So how about you? Do patients accept your care in spite of everything you know? I've witnessed many dentists overeducating and losing patients. Patient education can feel like lecturing, and in some cases, patients have perceived it as judgmental. Far worse, when patients who are not ready for care because of personal issues, a continued barrage of patient education feels like sales pressure. Sales pressure is a leading factor in patients abandoning practices. Now, the irony here is many dentists and team members don't realize they're exerting sales pressure. They believe education is good for patients. From my experience, patient education is overrated as a driver of case acceptance. Now, oh yes, I get it. We have to educate patients to their conditions, their consequences, and treatment options. I get that. But that's not what I'm talking about. When I say overrated, I'm saying we see it as the only way we can motivate patients to accept care. Well, it isn't. An additional way to motivate is to give them the experience of being understood. Your best bet is to offer patients proportional experiences of being educated and understood. To accomplish both, dentists and teams need to discover why patients are upset about their teeth, what tangible benefits they're seeking, how dental care must fit into their budgets, and when is the best time for them to begin dental care. Discover this first. Then patient education will have greater relevance and influence. Now, all this is important because for patients with minimal care needs, the sole emphasis on patient education, well, it can work well. However, as complexity of patient care increases, patient education diminishes influence. Giving patients experiences of being understood are the drivers of case acceptance for complex care patients. My advice, blend in large doses of understanding patients along with patient education. I'm Dr. Paul Homoly.